Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
We've taken 9 lessons from the eradication of smallpox that we think make a really useful framework for thinking about diseases, whether it's a new pandemic threat, whether it's a chronic disease, or I think it's useful even from the perspective of an individual patient.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Associate Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life.
Today we have 2 special guests with us to talk about their work on the Building Better Ancestors program, health equity, and vaccine access. So listeners, please enjoy Dr. Mark Rosenberg and Maria Goethe.
We're very excited to have with us today Dr. Mark Rosenberg and Maria Thacker Goethe from the Center for Global Health Innovation. So this is a very exciting day for Zoe and me to have these 2 great guests with us. Before we get into a discussion, I want to just turn it over first to Dr. Rosenberg to tell us a little bit about yourself, and then to Maria as well.
Well, thanks, Stephen. I have been very interested in what the patient experience is. I've worked in public health. I trained in internal medicine and infectious diseases and in psychiatry, and spent most of my career working in public health, working on violence prevention and working on global health issues, large-scale diseases that require collaboration and the collaboration of multiple institutions to try and address these problems.
Thank you so much for all the work that you've done, Dr. Rosenberg. And Maria, welcome to the Health Advocates. Can you introduce yourself, please?
Sure. It's great to be here. Thanks for inviting us and having the center, and of course, Dr. Rosenberg, one of our key community leaders, to join us on the podcast. Yes, my name is Maria Thacker Goethe. I'm CEO for the Center for Global Health Innovation. At the core of everything we've done for the last almost 17 years now for me has been around patients. How do we drive innovations and cures and therapies to patients to make them live their best life, have access, improved access to care, and affordable access to care? And I would say one of the highlights since I took over the organization a few years ago has been helping to establish one of the only patient advocacy alliances in the Southeast. And my role is working with industry and public health leaders is actually bringing them to the table to hear directly from the patient. Beginning this year, I'll actually be sitting on the governor's task force for rare diseases and here in Georgia. And I look forward to being the voice of innovation and industry alongside a number of patient groups for that committee starting this year.
So one of the great things that you guys are working on together is the Building Better Ancestors project. I wonder, Dr. Rosenberg, if you could tell us a little bit about the impetus for the project and what it is that the project hopes to learn and and what it aims to do, essentially.
About 3 years ago, the world celebrated the 40th anniversary of the eradication of smallpox. Smallpox was one of the most devastating diseases ever to hit planet Earth. In the last century alone, in the 20th century, more than 300 million people died from smallpox. And it's a horrendous, terrifying disease. But in 1980, the World Health Organization declared this disease eradicated. It was the first and only human disease ever wiped off the face of the earth. This was an extraordinary achievement. Really, when you think about the diseases we all live with now, this was a terrifying disease that was eradicated. And we thought it would be important to take what are some of the lessons from that success. This was the greatest success, the greatest achievement ever of global health. We said, let's take some of the lessons from that eradication and see if we can't use them in fighting future epidemics, future pandemics, and even diseases that we live with every day. Aren't there some lessons there that would be useful? And so we set about trying to extract the lessons and the things we learned. And we've taken 9 lessons from the eradication of smallpox that we think make a really useful framework for thinking about diseases, whether it's a new pandemic threat, whether it's a chronic disease, or I think it's useful even from the perspective of an individual patient. One of the differences between public health and healthcare is that in public health, you think of everybody who has the disease, the whole population at risk. In healthcare, you think about the patient who's in your office right now. That's your focus. It's a very important focus. But these are different. And public health is hard. It's hard to think about how you protect everyone and how you take everyone into account. And we thought that if we take these 9 lessons, it makes it easier to do the work, to see the big picture, to see the problem and understand the problem. And I think these 9 lessons are really applicable to an individual dealing with their own illness and their own disease. I can tell you very quickly what these 9 lessons are. The first one is this is a cause and effect world. If you understand the causes, you can change the effects. And science is the way we understand the cause and effect relationship. So it basically says use science to understand your problem. The second lesson is know the truth, share the truth, and act on the truth. Know about this pandemic, know where it's spread, know who's at risk, know your enemy, know the bacteria, know the virus. In terms of an individual's disease, it means find out everything you can about your illness so you can be in charge, so you can plot the course. But know the truth. Even if at first you think you can't stand to know everything, it's your best course. Find out, ask the questions, know the truth. The third lesson is coalitions are essential. These problems, whether it be COVID, smallpox, or an individual with severe chronic arthritis, it's important that we work with other people to solve them. For something like COVID-19, there's no one individual, there's no one institution that can solve the problem by themselves. As a patient, we need to form alliances with our care teams, with our families, with our friends. Coalitions are essential. Lesson 4 is avoid certainty. We don't know things for certain once and for all because our knowledge changes. Our mind changes. What we need to do to prevent or treat something changes as new things are found out, as new treatments and cures come into being. And if you're certain that you know everything about it, that means you don't want to learn anything more about this problem. But science evolves, things change. Avoid certainty. It's the Achilles heel of science. Lesson 5, build in evaluation and continuous improvement. We need to evaluate where we are with respect to a disease, and we need to take that information into account and be willing to change course as we go forward. Lesson 6, respect the culture. In global health, a lot of times we're working in countries that are foreign to us. We need to understand the culture. We don't tell people what to do. We work with them. We have to understand their perspective. Even if it's an individual patient, we need to understand the medical culture, and doctors need to understand us. Lesson number 7, seek strong leadership and management. The best decisions are made with the best science, but the best outcomes really depend on strong leadership and management. Take the helm. Step up into your disease, into your care plan. Help manage what's going to happen to you. Lesson number 8, mobilize political will. In the world of global health, if you want to get something done, it may involve having the government do it. It may involve having the World Health Organization act. It may involve Congress. But mobilize political will, because with it, you can do anything. Without it, almost nothing. And the last lesson, lesson number 9, move towards global health equity. The best solutions move us towards equity. And whether it's the equity of how vaccines are distributed or whether it's a public health problem like gun violence, we want to make sure that the people at greatest risk, the most vulnerable people, get the same attention, have the best chance of fighting this problem as those with the most resources. So those are the 9 lessons. I would turn it over to Maria because she has led some very important work on things like vaccine equity.
Definitely, and I would add I'm a patient myself, so I certainly am sit on a patient board, and I firmly believe in all these lessons. And at the Center for Global Health Innovation, the core to our mission is around using innovation to help achieve health equity. And these 9 lessons really align with how we operate, and they're integrated in everything we do now. All these lessons are crucial to what we do, including the vaccine work we've done for the last few years during COVID. And in particular, our work in vaccines has been, in getting vaccines to underserved and vaccine hesitant communities has been one of our biggest efforts during COVID. And I'll also mention that how we're moving, I wouldn't say beyond COVID because we still work in COVID, but how we want to apply some of the work we've been doing to other disease areas is really important. So the center over the last few years has worked closely with CDC and other federal agencies to tackle the challenge of talking about vaccines, vaccine hesitation, and building trust. And it has been all around coalitions. Our project over the last year has actually been the most one of the biggest projects we've had, and shown us a unique model that we can use to tackle other disease areas. The primary goal of the BAT program is to work in underserved and under-vaccinated communities to promote vaccine confidence in COVID-19 vaccine and increase vaccine rates. And to do this, we really leveraged our partner network and our collaborative strategies, so that already speaks to 2 of the lessons here, including coalition building as well as management, having the proper management to bring together an ecosystem of community health workers, local clinics, health professionals and providers, community-based organizations, public health expertise. And by building this coalition and building partnerships across a diverse set of public-private partnerships, we were able to do something that is core to everything we do at the center, and that is work to build trust. We work to have everybody at the table as we were developing training pathways, as we were providing training. We wanted the voice from, the person, the academic at Emory and Johns Hopkins, but we also needed to hear from people like Reverend Sheffield. We work with a lot of Black churches across these states, and understand, will what these experts are saying really resonate with the communities they're working in and providing care and education into. And by having them there at the front end of this entire process allowed us to build trust, have coalitions that people believe in, and frankly, now we have the momentum to tackle other things. So really, at the core of what we did, we identified and hired over 115 full and part-time community health workers across 13 communities in 7 states. And through that, we've been able to mobilize over 75 partner organizations, and we've reached over 1 million people to discuss vaccine hesitancy in just less than 6 months. Some of it's through direct intervention, some through social media, others through community health workers. And really what we've done is turn the model on its head. We find community health workers that live and work inside the communities they're providing care to, and not all of them are necessarily certified. They go through a training with us and they learn how to deliver care. And the thing is, we're meeting communities where they're at. So, a 9 to 5 community health worker may not be able to go to a church service or a get together after a church service on a Sunday afternoon because they work Monday through Friday. By us working and identifying community workers that live and work in that faith-based area in that particular case, they're there. They're at the dinners for the community on Saturday or the soccer game or whatever it might be. The best thing is we've had real economic impact into these communities. We've created jobs. We pay, of course, the community health workers. We do not come in and say, we need you to volunteer for the good of your community. We're giving you a livable wage for this work. We've been able to really tackle and address a variety of different social determinants of health through this. And what we've seen now is these communities and these community health workers are like, okay, COVID, great, let's keep doing that. And now we're looking to scale this program beyond just vaccine education and training to tackle a lot of these other disease areas. And we're very excited about, the impact we're having and how we're empowering these communities to take ownership of creating the change. And And they also learn about these amazing innovations.
Well, very exciting, and we definitely look forward to seeing the public launch of what you are finding. I'm wondering, Maria, if you could tell us, or Dr. Rosenberg, or both, talk about the 9 key lessons that you describe, and how you think it's going to impact patients, as the hope is that it develops more in the community, both the healthcare community, as well the patient community, and just the general population.
Good question, Steven. I think that this framework is a way for patients to take control of their health and of their care. And working for many years as a physician and working with patients, I came to understand that being in charge of your own health and your own health care is not easy. It's kind of like attacking an epidemic or a pandemic, whether it be COVID or Ebola or TB or measles, heart disease, diabetes. It's not easy, and you need some help, especially since doctors for many, many years didn't really share information with patients. They didn't. And what patients need, I think, is a framework for understanding everything that can impact their health. And this is a framework that will do it. We have a website called 9 Lessons, the number 9, 9lessons.org. And on that website, anyone can go there. One of the driving forces behind this project was that we wanted to make this information available for free to everyone. The future leaders of patient health and patient care is everybody who's a patient. And we may not all think of ourselves as patients yet, but we will be. Sooner or later, we will be. We all spend time in healthcare. We all will spend time in a hospital. And how do we navigate this? So these 9 lessons are available for everyone on 9lessons.org. And there's a trailer that explains the origins of this project, how it came from, and why it evolved from the lessons of smallpox. Unfortunately, when there's a pandemic like COVID, everyone gets worked up about it. Everyone at first is scared and frightened. We see pictures of patients on respirators dying in hospitals, overwhelmed doctors and nurses and healthcare workers. And for a while, but unfortunately only for a while, we're all paying attention. We're doing what we need to do and we're learning what we need to learn. But as soon as the big threat passes, we seem to forget the lessons that we learned. And we go back to not investing in developing new vaccines, developing new treatments, informing people. As Maria said, it's really important that people understand and that the doctors and healthcare workers understand the people and where they're coming from. People are not born with vaccine hesitancy. They're not born afraid of the hospital, but fear often keeps us back. But these 9 lessons, I think, are a way to overcome any fears we may have. They're kind of clear directions on what we need to take control, whether it's of a pandemic or of our own illness. And they're very useful.
Thank you, Dr. Rosenberg. I totally agree. Maria, I'll turn it over to you. What do you hope that people will learn and what this will improve for lives of patients and public health generally?
Well, I really think Mark hit on it all. I think for me, I also hope that it creates some actionable results and efforts. So, and that gets around really to who the center is and what we believe. We believe global is local. I think that's one thing I continue to stress. We have communities that have very poor health impact numbers and health data points. And it's not just over there. Global is not just over there. We have challenges in Southwest Atlanta. We have challenges in Appalachia. We have challenges in a variety of different communities that can be impacted by the work of public health professionals and innovation. My hope is really these lessons are picked up and harnessed by not just future public health leaders and providers, but also innovators so they understand their piece in the entire puzzle building process here to tackle health inequity. That is what the center was designed to do, to really advocate, whether that's through coalition building, true policy, educating policymakers, and also creating a voice on behalf of public health beyond just other entities. We want to talk about it in our day-to-day communication. Everything we're going to do as we move forward will be tying in these 9 lessons, because coalition building and all the other 9 lessons are crucial to everything we do as an organization, and we've seen it's necessary in order to make change in these communities. So that's really what our focus is going to be, and that's how I see these making an impact, at least with the work we're doing here at the center. But hopefully also we'll be able to elevate the work that many other global health organizations are doing, that many people in the public are unaware of.
I want to leave you with a word about lesson number 9, that the best solutions move us closer to global health equity. And someone I called a brother I was very close to and loved was a tremendous pioneer in the area of global health named Paul Farmer. And Paul died last year. But one of the things Paul always said is that the source of all evil in this world is the belief that some lives are worth less than others. The belief that some lives are worth less than others. And it means that if you're a poor person in a poor country with a chronic disease like drug-resistant TB, your life is still worth as much as anyone who's rich from a well-developed country. And I think on a personal level, it means that even if we have a disease or 2 or 3, that we are just as important as anyone else. Our life is as important as someone who's not sick at all. If we're old, our life is as important as someone who's young and very healthy. And I think that keeping this in mind, that the best solutions move us towards health equity, we all are. We all are equally important. And I think this notion of taking charge of our health care, of our lives and our family, that's really the core of what these 9 lessons are about, helping us take charge and move towards becoming better people, becoming better ancestors, and taking what all of us have learned from our experience. And the experience of living with a chronic disease teaches us so much. We learn so much. And this project says, take stock of what you've learned and pass it on. Pass it on to your children, to your friends, to your family, to the world. Become a better ancestor. It's within all of our grasps. It's within our reach. That's what it's about. Living better lives and passing on what we know to ensure a better future. So thanks for this chance to talk about these things. We really appreciate what you do and the chance you're giving us to share our messages.
Yeah, and thank you both for coming on our show and sharing your message and all the work that you're doing.
Yes, thank you.
I was just going to close by saying, please go check out the trailer. Go to 9lessons.org. These are 9 simple, proven, and reliable ways to approach global health threats learned from the successful effort to eradicate smallpox. They provide guidance for addressing all sorts of problems from COVID-19 to climate change, structural racism, gender equity, and criminal justice. It really applies to everybody, and it really can be a valuable asset for how you leave your legacy behind.
Thank you both so much for joining us and for all the work that you do to uplift the voices of the community.
Well, that was great hearing from Dr. Rosenberg and Maria. It's fantastic the work that they're doing.
I know. So, what did you learn today? Give us one. There were so many, but help pick one out.
I guess my learning is just how many folks are out there doing such great things, and to hear about their particular plan in addressing health equity, really eye-opening.
And I really loved hearing from Dr. Rosenberg about, the value of a life and the importance of each life, especially when you're disabled and have chronic illness, that you still matter.
Absolutely. Well, we hope that you learned something too. And before we go, please make sure you take a listen to Talking Head Pain. New episodes are out. Check it out, along with all of our podcasts at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you like this episode, please give us a rating and write a review on Apple Podcasts. Hit that subscribe button and check out YouTube. I'm Zoe Rothblatt.
I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.